Copyright, University of South Australia. This recording may contain third-party copyright material. Apart from any use permitted under the Copyright Act 1968, no part of this recording may be reproduced or rebroadcast by any means or process without the prior written permission of the University of South Australia and the copyright owners.
Welcome to a short video on the muscles of the hip and muscles of the thigh. So here I have a model of the muscles around the pelvis and the muscles around the thigh. So if we just orientate ourselves to begin with, here we've got features like the anterior superior iliac spine and the pubic tubercle. So what we can see here is the inguinal ligament running between these, which we'll talk about in a little bit more detail later. So this shows us that we're anterior, right? Medial would be this way, lateral this way, and posterior towards the table. So if we start with our gluteal region of muscles on the posterior and lateral aspects, here we can see a muscle which is very large, the heaviest and strongest muscle of our body. This is our gluteus maximus. Now, as you can see that it's posterior to the hip joint, what it's actually going to do is when the muscle shortens, so the insertion will pull towards the origin, it's going to pull the femur backwards. Now, if we pull the femur backwards, we increase the angle around the anterior aspect of the joint, and therefore this is considered to be extension. You can see here that it also attaches onto the lateral aspect of the femur, and so therefore when it pulls, some of the horizontal fibres that are associated with the gluteus maximus help to also externally rotate the femur whilst it's being contracted. Now, this muscle has a broad origin around the iliac crest and the sacrum and some dense ligaments which would lie deeper to that, and then it inserts into two places, one on the femur and here to this thick band of fascia called your iliotibial band or iliotibial tract. If we remove this muscle, what it allows us to do is have a look at some of the more deeper gluteal muscles that are around the hip and the pelvis. All right, so here what we can see is we can see the muscle fibre of gluteus medius. All right, so it's not the largest, it's not the smallest, all right, it's the one that's in the middle size. So gluteus medius here, you can see coming from the iliac crest. It would then come down and attach onto a large bony process on the lateral aspect of the femur, and that's the greater trochanter. So this area which is shaded in blue is the area where your gluteus medius would attach. Now, being that it's on the lateral aspect of the hip and not posterior, it's actually going to create abduction. All right, so this muscle is really important in walking and really important in stabilizing the hip joint once you take the opposite leg off the floor. Now, some other deeper muscles which lie around under gluteus medius, maximus, that are here, and these ones are called your short external rotators. Now, as a group, you can just remember them as the P, Go, Go, Q. We wouldn't ask you to remember those muscles individually just yet. More detailed anatomy to come in further semesters. Right, so they all attach once again onto the greater trochanter, but more to the posterior aspect, just anterior to this little lip here, which is called the intertrochanteric crest. So they all attach in here like this, and when they pull as a complex, they would externally rotate your femurs. If we have a look to the more anterior aspect, this muscle here, which it embeds itself into this lateral fascia, or the iliotibial band, is called tensor fascia lata. Right? Now, when you are standing and your feet are off the ground, this muscle is there to help flex your hip. But what actually resists, it would resist any amounts of hyperextension around the hip joint during the walking phase. Now, if we remove that one from here, then what we might be able to see is some deeper muscle fibres, all right, coming into the anterior thigh. So now that we're in the anterior thigh, we've got some muscles which flex the hip. Okay, so what we need to do is actually remember some very big muscles that come from inside the body before we start talking about the rest of the thigh muscles for hip flexion. So as an example, this one here is called psoas major. So P-S-O-A-S, silent P, psoas major. And that actually joins with this one lying in the iliac fossa, right, which is called iliacus. So the two of these together can be called iliopsoas, all right? And now where they will attach, so originating from up inside the body, all right, they're going to come and they're going to attach here. Now, if this is the greater trochanter, here we can see a slightly smaller one, so that's our lesser trochanter. Right, so if we put our pelvis back together, just quickly, and let's imagine how that muscle works. If it's going to originate from inside the body and the iliac fossa here, it passes over this ramus, all right, and over this bump, and it's tending to come down here to the lesser trochanter. So when the muscle pulls, it's going to lift this process here, the lesser trochanter, upwards and forwards like this. So this is your really strong, very powerful hip flexors of the iliopsoas. All right. Now, other muscles that flex the hip, then you can see any muscle that's going to go over the hip joint, which will lie about here, is going to also flex the hip because its origin is more superior or proximal to the hip joint. So this muscle, this long strap-like muscle, which passes from your anterior superior iliac spine all the way down to the medial aspect of your tibia here, is your sartorius muscle. Now this one's also commonly called your Taylor's muscle, all right? And it's actually considered to be a part of the anterior thigh group of muscles. So that's your sartorius, a long strap-like one. Right, now it has a few different functions. Because it comes from the anterior thigh and in front of the hip joint, it will flex the hip. But also, because it crosses the knee, but posterior to the axis of the knee's motion, it'll also create flexion upon the knee. So just be careful though when you're talking about this muscle. We generally include it into the anterior thigh, so consider it more as a hip flexor. All right, so just for this course, think about it as a hip flexor rather than anything else, okay? Just because we don't want you getting confused about what this muscle does. Now, another big muscle which also flexes the hip, all right, and lies just nearby, is the rectus femoris muscle. So our rectus femoris muscle is this one here. Now, rectus or recta means to be straight or upright. So you can see a long muscle here which is straight or upright, all right, lying just deeper to the sartorius muscle. So if we remove that one, here we can see rectus femoris. Now it's got two bellies, all right, really powerful muscle actually. So it originates from your pelvis, all right, so not the anterior superior like sartorius, but the anterior inferior spine, so therefore crossing the hip joint. And it comes down and it joins with the rest of your quadriceps, all right. So the vasti is what they're called, all right. They share a common tendon which goes around the patella, and these muscles are therefore your quads. So rectus femoris is one, and if we remove that, then we can see what lies deeper, all right, and that is your vastus intermedius muscle, bound medially by the vastus medialis and laterally by the vastus lateralis. So these muscles are your anterior thyroid quads. And what we can see here is we can see a nerve, an artery and a vein. So if we pay attention to these now whilst we're on the anterior aspect, if I just quickly put sartorius back in its place, what we can actually see is that your sartorius muscle, along with the inguinal ligament and the adductor longus muscle here, they form a triangular space on the anterior aspect of the thigh, and this is your femoral triangle. So from the inside here we can see a blood vessel, which would be the common iliac artery, dividing into a branch which is heading towards the outside, external iliac artery, and a branch going inside, internal iliac artery. Now this one feeds your pelvic organs like your urinary bladder or the rectum and the prostate and the uterus, things like this, whereas the external then goes out towards your thigh. Once it passes underneath the ligament here, it becomes the femoral artery. So the three structures that we can see here then would be femoral vein, femoral artery, and femoral nerve. So at some stage you'll be asked a question about these structures here. So the femoral triangle, what borders it, or possibly even how to draw it. And we'll talk to you about that one in a little bit more detail later. So the femoral nerve innervates then the five muscles of the anterior thigh: sartorius, rectus femoris, vastus lateralis, vastus intermedius, and vastus medialis. Moving on to the medial thigh, all right, we have our adductor muscles. Now there's five in this group again. All right, and whilst we can't see all of them, unfortunately, because it's a model, we can appreciate that this one here is called adductor longus. All right, then this one here is your gracilis. Then you have the larger one at the back, which is called adductor magnus, and then there would one be deeper, all right, than the adductor longus, which is called your adductor brevis. Now, all of these muscles, based on their name being called adductor muscles, you can expect that they're going to do adduction of the hip. All right. Now it's also that your adductor magnus might do some hip extension when you're right down at the bottom of the squat, trying to stand back up again. Now these ones here are all innervated by a nerve that you can see here coming through the pelvis, which is going to pass through the obturator foramen. So you can probably guess what the name of that nerve is going to be. It's going to be the obturator nerve, supplying the adductor or medial thigh group of muscles. Moving posteriorly here, what we can see is our favourite group of muscles, the hamstrings. Alright, so our hamstring muscles contains 3. Now we can see a nerve coming out the posterior aspect of the pelvis, which would then be coming in to supply your hamstring muscles, alright, and this is your sciatic nerve, alright. Now your hamstring group of muscles, they all come from a common origin, alright, on the inferior aspect of the pelvis, that's here. So this bone, we remember that this is the ischium, alright, because it's below the line of the ilium from the back, and that rough area that you can see here is your ischial tuberosity. So this is a common origin. Now you can actually feel this, alright, on yourself. So if you sit on your hands and wiggle from side to side, you can feel this bony prominence here, which is your ischial tuberosity, and is the common origin of your hamstring muscles. Now medially, there are 2, and laterally there is 1, but that on the lateral side also has 2 heads. So anything that has 2 heads, you would generally call biceps. So bi being 2, and sep being head. Alright, so cephalo is the Greek word for head in this case. So biceps femoris, this muscle here, alright, it travels from the ischial tuberosity right down to the head of your fibula, alright, whereas your semimembranosus, which is the deeper one here, and semitendinosus, which is the more superficial one here, they both go towards the medial aspect of the tibia. So together, because they lie behind the hip joint, they're going to create extension around the hip joint, and they're also going to create flexion around the knee. Alright, so if we remove the muscles that we can see here, so the lateral one being bicep femoris, okay, and then the medial one being semitendinosus superficially, and semimembranosus more broad and more deep, we can see the sciatic nerve coming down, which will be innervating that group of muscles. Alright, now if we continue really quickly with the blood supply in this region, here we can see that the artery which was from the front, alright, has also now come to the back. So we've had another area change here. So now where it was called femoral in the anterior aspect is now behind the knee, so we would call it popliteal. You can also see that the sciatic nerve, which is this singular part here, has divided as well. So we need a few name changes in this part. So now that we're in this diamond-shaped space behind the knee, this is our popliteal fossa. Right? So what can we see is that we would have the bicep femoris muscle laterally, which we just removed, and the semimembranosus and tendinosus muscles, which we removed on the medial aspect here. They make the upper part of the diamond. This muscle below is your calf muscle and is called the gastrocnemius, making the lower borders of the fossa here. So in that fossa we can see the popliteal artery, because it changed name from the anterior aspect to the posterior, the popliteal vein, right, in blue, and then these 2 divisions of the sciatic nerve, which are called common fibula, one travelling towards the fibular aspect, and the tibial nerve coming and travelling straight down. Right, so that was a bit of an overview on the muscles and the thigh region, and we'll go into the knee next. Thanks.